Yes, we still have some folks coming in from the waiting room. Okay. Hope everyone's day today is off to a good start and everyone is excited to be here talking about veteran oral health in Iowa. So I'm Liz Flannery. I'm the Director of Education and Leadership here at the American Institute of Dental Public Health, and I'll be leading us through our talk here today. I'm just keeping an eye on the waiting room. And I think so far everyone's joined us. So if additional folks join, we will let them in. We're going to go ahead and get started. I have Christine Coffey, who's our Director of Communications at AIDPH. She's here with me as well today, and she is going to be admin support with us. So we can go ahead and click to the next slide, Christine, if that's okay with you. Okay, great. So today I'm going to give you a quick overview of who AIDPH is and why we're here talking to you about veteran oral health in Iowa. We're going to talk about veteran oral health at the national level and then specifically at the Iowa level and what veteran oral health looks like in your state. This session is designed to be very interactive, so you'll see that we have several points of interaction woven throughout. I hope you're ready to engage. I see several of you here on video. If you aren't already and you're able, I invite you to join with your camera and get ready to share your thoughts because we won't just want to talk and share data with you. We want to hear from you and hear about what you're seeing at the local level and what things look like for you as a stakeholder in Iowa. So we can go ahead and go to the next slide. And just a few quick housekeeping things. We are recording this session. We'll have this recording as well as the slides will be available on our Academy. There are CUs attached to this session and we'll give you information on how to request those via our Academy at the end of this session. Again, this is an opportunity for you to connect with local stakeholders in addition to hearing some high-level data about your state. So please take a moment and introduce yourself in the chat. Type your email, your organization, so that as you have conversations and share the work you're doing, you can make those local connections as well. And if you have any questions outside of our prompts, please share those in the chat with us as well. And I'm still on waiting room, so I'm going to switch my chat over so I can see what folks are putting in there. We can go ahead to the next slide. Okay, so we are going to engage via Slido. I see some of you have been at our events before. I know that you have used Slido. For those who haven't, Slido is just an engagement tool. It allows us to share answers to questions, respond to polls. So I invite you to either pull up slido.com and put in this code or scan the QR code there with your phone and pull up Slido and keep it up either on your browser or on your phone because we're going to use it throughout our session here today. Okay, we can go ahead and go to the next slide. Okay, these are our learning objectives. These are connected to our CEU information. They were involved in your registration. And we are going to, again, be looking at some state-specific data. We're going to be looking at existing policies and how we can advocate for reform. We're going to have collaboration with our local stakeholders, and again, look at evidence-based strategies to move forward. So to get us warmed up, we can click to the next slide and see our first question here. If we want to go over to Slido and answer it, we want to hear what brought you to today's session. So we want to know, are you looking to learn, to share, to connect, act, or maybe all four of those? We can kind of see what's going on with Slido. So you can see those results if you're clicked over there. I see that 50% of folks are looking to learn. That's great. Okay. 43% have all of the above. Popping up to 63% to learn. Okay, that's great. I hope we can learn looking at the data that we have to share about from each other as well. Okay, great. We'll head to the next slide, and I'm glad to see that it looks like Slido is working well for everyone. I'm sharing that I don't have any disclosures to share today as your presenter, and we can go to the next slide. Okay. And again, just to introduce, I introduced myself at the top of the call. I'm Liz Flannery. I'm the Director of Education at AIDPH. I have Christine Coffey with me here as staff support from AIDPH. She's our Director of Communications. Annalise Cawthorn, our co-founder and Executive Director, will be joining us in just a few short minutes. And we want to take a minute and say a big thank you to Carly Ross for supporting us in this work and coming from the coalition and really making sure that we could share this information out with all of you local stakeholders. So thank you, Carly, and thank you, Anna, for working with Shayla to set this up with us here today, and for all of you joining us and coming on for this important discussion. Carly, did you want me to pass it over to you, Frank? Did you want to do an introduction? I'm happy to pass over the mic for a minute for you to say hello.
No, thank you. Just good morning to everyone. Thanks to all the folks here in Iowa for being on the call. And I know I'm certainly excited to learn more about this important issue. I know that many times questions come up about veterans' oral health, and I'm excited to be able to gain a little bit of new knowledge today. So thanks to you all for being here.
Okay, fantastic. Thank you again. All right, let's dive in. We can go to the next slide. Okay, so we want to hear, toggling back again to Slido, what do you believe are the top priority areas for veteran oral health in your state? And I'm going to go over to Slido to make sure I can launch that for you. So that poll is active now. So we're looking at access to care, oral health literacy, workforce development, policy advocacy, integration with general health care. Out of those, what do you believe are the top priority areas for veteran oral health in your state? So far, I'm seeing access to care is 100%. And as you may or may not know, we are doing this seminar. Our goal is to get to every state in the country. So this is not the first time that we've given this seminar. It is, of course, the first time in Iowa. But I will share that I think access to care is always the number one vote on this poll, is what we're seeing across the states. Policy advocacy is another big one that comes up. Okay. All right. 88% at access to care. Okay. All right. We can head on over to our next slide. I'll just make sure I'm caught up. We can go to the next one. I'm just going to give a real quick overview. Christine, if you just want to toggle to the next slide, I'll give a quick overview of who we are as AIDPH. I think many of you have been with us to talk about our work in Iowa. Iowa is very unique because we've had the privilege of not only developing these state profiles, which we're talking about in every state of the country, but as many of you may know, we've done more in-depth reporting and analysis on Iowa. So we've actually been with your state quite a bit and looked very in-depth and worked with you, many of you before. So I know some of you are familiar with us. We're a 501c3 nonprofit. Our mission is to empower our community to advance oral health through science, education, and advocacy. So again, taking that data, using it to educate our community, our dental public health workforce, our public health workforce, and use that to make change and advance oral health. And we do that because we have a vision of a justice-oriented oral health system. If we go to the next slide, you'll see that we have 4 communities of focus who we're going to be talking about here today. Our communities of focus include LGBTQIA+ people, veterans, people with disabilities, and people in rural communities. And we can go to the next slide, and we'll see, of course, that there is intersectionality on our 4 communities of focus. Approximately 30% of veterans report having a disability, and approximately 25% of veterans live in a rural area, something that we'll talk about more today as we dive into the data. And of course, all of our communities of focus have the common experience of being historically excluded and marginalized from healthcare systems. So we can go to the next slide. We just want to take a minute and say thank you to CareQuest as our funder for this Veteran Oral Health virtual road tour that we're doing. If we go to the next slide, you can kind of see a timeline of the work and partnership. Oh, Christine?
Yeah, hi Liz, sorry to bother. Could you put the Slido link in the chat? I can't
Sure.
get out of the screen. One of our participants. Yeah, thank you. Okay.
Yeah, absolutely. Let me actually see. popping this over. Thank you for your patience, everyone. I'm going to grab it from a different spot. So thank you for your patience, everyone. Okay. So our slide here today, as I grab this Slido link, is looking at a timeline of the work that we have done with veteran oral health in partnership with CareQuest Institute. So we started back in 2021. CareQuest came to Annalise, again, who's our co-founder and executive director, who may have joined us at this point on the call, and said, what do we know about veteran oral health? And Annalise's story, as many of you may have heard her say, she's the spouse of a veteran, and would say, you know what, I'm kind of embarrassed to say we don't know much. I think what we had on veteran oral health fit maybe on a half a page of paper. And that really was the call to action to dive into veteran oral health. And we started through a partnership with the VSOs, the Veteran Service Organizations, to work directly with veterans themselves to begin data collection through surveys. We then did publicly available data sets and analysis there, and the body of research really grew. And again, we had the privilege of going in depth into the data in Iowa. As part of that work, we were able to do and have done many different advocacy projects with this work, with Senate committee hearings, with different Hill days. Annalise and I just got back from being in DC last week at our Hill Day, where veteran oral health was one of our main asks. Okay, we can go to the next slide. And the next one, and again, we're going to start with a national overview. We're here to talk about your state and what the data looks like. But we always start at the national level. This might be familiar for some of you, but what we found over and over again, even sometimes with our partners who work in veteran oral health or veterans themselves, that folks aren't always fully aware of how VA medical and dental benefits actually work. So we're going to start there. So what care veterans can receive or don't receive, or even where and how they can access the care. That's where we like to start. A clear picture of what's currently available through the VA and what veteran oral health looks like at the national level. So the key point of this is that eligibility for medical and dental care through the VA isn't set by the VA itself. It's determined by Congress through a federal law called Title 38. That law outlines what care is covered, who qualifies, how much it costs, and where it can be delivered. And because of that, any major change, like expanding dental coverage, requires congressional action. It's not just a policy update. It involves passing new legislation and securing federal funding to support it. So when we talk about the limitations in access to dental care for veterans through the VA, it all ties back to that federal level. So I also want to point out that that doesn't mean we can't take action and impact change at the local and state level. It takes getting educated like we're doing here today in collaboration with our local communities. I think also you folks in Iowa know this specifically. We always highlight Iowa with other states because you have some really innovative programming, specifically the Trust Fund, that provides some innovative state-based solutions to getting veterans that access to care. We can go to the next slide. So looking again at kind of the state of affairs and where we're starting. Currently, most veterans are not eligible for dental care through the VA. So if we look at this graphic here, these people that you see represent all 18 million veterans living in the US today. The lighter colored half shows the veterans who either receive care outside the VA or aren't eligible for VA healthcare at all. And as you move to the left on the chart, that darker blue color section represents about 9 million veterans enrolled in VA healthcare. And of those, only a tiny fraction, that small blue and red segment, is actually eligible for dental care through the VA. So what that means is veterans might be going to the VA for a medical appointment, getting treatment for chronic condition, but leaving with dental pain because they're not eligible to get that care there. And then even among the about 1.8 million veterans who are eligible for dental benefits, only about a third of them actually use those dental benefits. We need more information there on the data of why that utilization rate is low, but we suspect that barriers to care and lack of awareness play a big role in that piece. Okay. So we can go to the next slide, and we're going to look at some of the systemic pieces that I think many of us know working in dental care in general. Veterans living with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues. And what's even more concerning is that veterans with these high risk, high cost conditions are more likely to lose all of their permanent teeth. And we see poorer oral health outcomes for veterans than non-veterans, even if they have seen a dentist in the past year. So access alone isn't solving the problem. Even when veterans are getting the dental care, many still face some of the worst oral health outcomes. And a big reason for this is a lack of the integrated care. The chronic conditions aren't being addressed in coordination with oral health needs. So looking at that a little more specifically, we can head to the next slide. And here we're sharing some recent research for AIDPH. We'll share some links in just a bit where you can access all of our publications. This research is really focusing on the connection between chronic disease and oral health. So even after controlling for factors like income, education, and whether someone lives in a rural area or not, we found that veterans with diabetes were still 40% more likely to be edentulous, meaning they've lost all of their natural teeth, compared to veterans without diabetes. If we go to the next slide, we see just as concerning are the findings related to heart disease. So veterans with heart disease are 30% more likely to become completely edentulous compared to veterans without heart disease. Thank you, Christine, for popping that link in the chat of where this data can be found. So again, this is just reinforcing what we're seeing across the board, that chronic conditions like heart disease and diabetes have a significant impact on oral health outcomes for veterans. And we can go to the next slide and look at it at this systematic level. What we really want to highlight is it isn't just about poor oral health outcomes or reduced quality of life. Of course, those are incredibly serious concerns, but it's also about the broader health impact and the cost of care. So when dental care is managed as part of an integrated healthcare system, like what we see at the VA and what the VA could offer if dental coverage was expanded, there's a clear opportunity for cost savings, especially for veterans with chronic conditions. So some of our recent research shows that for every $1 invested in dental care as part of diabetes management, there's a $1 savings in related medical costs. It's more impactful when we look at heart disease. Every $1 spent on preventative oral health can result in $2 saved in heart disease management. So at that point, the dental care isn't just a health benefit, it's really paying for itself. And that's just important context to keep in mind as we look at chronic disease trends in Iowa and considering what solutions might look like in your state. If we go to the next slide, I just want to highlight here that these are data points collected through research and CareQuest Institute. They come from BARFIS, a National Survey of Veterans Administration in 2021, and from data access through the VA. We can go to the next slide. So Christine shared the link here, vetdentaldata.org, which of course houses our publications. Our very comprehensive Iowa Veteran Oral Health Report is here. The state profile that we're going to dive into is there, but there's also a lot of interactive features, and that's what I'm going to highlight here. So we can get more interactive insights on rural veterans, cost of care, and state-based indicators. They can be assessed here through the dashboards that we have set up. We have an entire tab dedicated to rural veterans. Again, we know that veterans disproportionately live in rural areas, and those with the rurality combined with the veteran piece, we have additional disparities. Okay. And I also just want to notice that the data here, there's not state-based data available through MEPS, which is the Military Entrance Process Station. They're not available at the state level, but they can be evaluated by region. So you can get a sort of a proxy for state level data with these indicators through the interactive dashboard. Okay. And if we go to the next slide, When you click on the rural tab, it will take you to the interactive dashboard on rural veterans. So across each indicator, it's clear to see that rural veterans delay dental care due to cost, spend more out of pocket on dental care, and struggle to find accessible locations for dental care. And this is all veterans. So this is veterans versus rural veterans that we're looking at versus veterans versus non-veterans, if that makes sense. And I know we're really getting in the weeds here, but we just want to give you an overview of what you can kind of do with the data and kind of how you can go in and take a look and manipulate the pieces and use the interactive dashboard for the work that you're doing. Okay, we can go to the next slide. And again, just noting that rural veterans also feel more impact from lack of access and utilization to dental care, often citing that the state of their mouth or teeth is embarrassing compared to non-rural veterans. And rural veterans also struggle more with a functional dentition, which likely leads to the data points we see around increased cost of care and higher emergency department use, which again ties back to that systems piece when we're looking at the impact to that overall healthcare system and how that can be looking in your state. Looking at
Liz,
the
I'm
next
going to interrupt you. Sorry, I'm just going to interrupt you. Annalise just joined, and she just needs to have co-host status so she can jump on.
Yep, I made her a
don't
co-host.
have.
I think so.
Okay, thanks. Sorry to interrupt.
Okay. Are you all set, Annalise?
I am. Thank you. Sorry to interrupt.
No, that's okay. Okay. So we're looking here, again, we popped this link in the chat on vetdentaldata.org and encourage you to go here. In just a second, we're going to get to your state profile. So if you go to vetdentaldata.org and click publications, you can click the Iowa and pull up your state profile. And again, later, go to the full report we have there. If we go to the next slide, again, as we start to kick things off, looking at the state level and digging in a little more to Iowa, giving a background on why we're doing this tour. So again, we started with national level data when we started doing our veteran oral health research. And we've developed this set of resources because as we were going out and talking to folks at the national level, we really were getting a question over and over again. What do things look like at our state? And that's where we kind of took that as our directive to develop out profiles for all 50 states. And the really great thing about that is that you can get a really overview shot not only of your state, but you can do comparative to states around you, states that have similar environments, whether that be the healthcare system or politically, and really take lessons learned. And that's part of what we're doing here on these virtual road tours, are having these community conversations about what's going on in your state, as sharing out what other states are doing for best practices. Okay. We can go to the next slide and then the next. So we are about to really get to the good part and dive into Iowa a little bit more. But first, we're going to pop over to Slido one more time and do our next poll. And before we dive into looking at Iowa, I would like to hear what you think is your state's biggest challenge for veteran oral health. I see people typing, so I will give you all a second to pull that up. Okay, access, cost, access to care. Yeah, and I know this came up earlier, and I shared out access is really what we're seeing across the board, and I think every state that we have spoken to, it's the biggest piece. Policy, so that's reflective of what we talked about at the top of the call. Access to care. Okay. All right. Access and access to care are really, and cost is here multiple times in policy. Thank you all for interacting there. That gives us a good place to start and good context as we go through our state pieces and how we can talk about your data. So without further ado, let's take a look at your profile. Again, I invite you to pull it up and follow along as we look at it. We can head to the next slide. So really kind of going through this, if you're using this in your work to talk to a decision maker, to look at developing out a grant, we open each profile with some quick context, what's happening in Iowa and how it fits into the bigger picture nationally, especially when it comes to dental care through the VA. So again, the key point we always include, most veterans are not eligible for dental care through the VA. We recommend starting there. We find it's always surprising. And so again, if you're having those conversations with decision makers, start there to really kind of give the context when for people who might not be familiar with the topic. Okay. We've also included data on where veterans live across Iowa, especially counties with high concentrations, and we pulled in whatever we could find on rural veterans. Veterans are more likely to live in rural areas, as we know, so that kind of gives you a quick overview. And it's also an interesting point to compare with other maps, like where VA clinics are located and VA clinics with dental clinics within them. If we head to the next slide, we compare Iowa to national averages, because without that context, numbers don't really mean much, right? So if you're sharing this with a policymaker, a veteran, a program leader, they might not know if 17% is high, low, or somewhere in between. So we really wanted to make sure there was context there and what how things were looking at your state. So again, you can also compare across states if that's helpful. Some states have higher challenges or demographics, and as someone working in Iowa, you probably know which comparisons make the most sense for you to look at. All 50 state profiles are available on your website. Earlier, I mentioned chronic disease, those high-cost, high-risk conditions like heart disease and diabetes that are closely connected to oral health. Because those connections came through strongly in our research, we wanted to make it easy for you to highlight them when you're talking to decision makers or planning programming in your work. So in this section, you'll find data on heart disease, diabetes, insurance status, and indentulism, all compared to national figures, again, for that context piece. And we've also ranked each state across those 4 key outcomes. So you'll see where Iowa falls compared to all 50 states. And just a heads up on that, those rankings, number 1 is the lowest, the worst outcome there. Okay, we can head to the next slide. And this is where we come to our report card. We chose the report card setup because we felt like it was a really quick snapshot. Everyone understands what a report card is and kind of gives you a directive. So when you see that piece, I know in my school time, if I was seeing a C there, that told me that wasn't going to be something that felt acceptable to me. So it gives people really a quick snapshot there. What I do want to point out is, we have the individual grades and the overall grades, and taking a look at those in combination, it might not just be where are those needs for improvement, but where are we doing better and how did we get to that success? Why are we doing better in this area? And are there any lessons learned that we can apply to the places where we need improvement? And similarly, if we're looking at other states, did they have successful areas where we can talk to our colleagues, our peers, or look at information on what they're doing to have success in that one area, and take that and apply it to the areas that need improvement? If we go to the next slide, we just wanted to highlight this part of the dashboard. It allows you to quickly gain insights on key indicators, comparing other states. So again, we talked about that, and you can pull up the full profiles and look, but if you're looking for a really quick snapshot, if you hover over, it will pull up that data and just be a fast way for you to get that quick comparison. Okay. We're going to go to the next slide. I've been talking quite a bit, and I promised that this was an interactive session. So I would love for folks to take a minute and either post in the chat or come off mute and share. That was a lot of information on your state, but it's limited to what the data shows us. So I would like to hear, what is one barrier that isn't in the data, but is real for veterans in your community? What else is going on that's not reflected here in the data? Fear. I think that's a really salient point, Melissa. Does anyone else have any other pieces that they'd like to share? Okay. I see Alyssa. Having a patient care coordinator to help them make appointments or get to appointments. And Alyssa, do you mind sharing a little bit more? Is that we need more of that? More resources to make that happen?
Oh, can you hear me?
Yes, I can. Yeah.
Yeah, I guess sometimes it's just like some of the veterans are disabled and they require special transportation to get there, and not knowing where to go, having, a representative either to help them get insurance or even apply, figure out what paperwork you need to apply for a sliding fee scale, or what paperwork you need to do for, it's just like a lot of adult things that's kind of hard to figure out where to get this help from when there is some availability, and having, we call it a patient care coordinator, I would say like a personal assistant to like help them with these things.
Thank you. Yeah, that would be huge, I think. Um, okay, I'm also looking, I see a theme here. I see that Brendan is saying perhaps PTSD, which can make dental visits a challenge. I know trauma-informed care training has come up a lot in the work that we've done in veteran oral health in general, but also specifically in Iowa, and how impactful that can be. Carol saying fear is huge. I have experience with veterans who have had chemical dependency issues in past or even current. Absolutely. And Annalise is double tapping that those aren't captured in large data sets. So, I also would say with this conversation, are there ways that we can be capturing this in the state for you, or ways that we can be capturing it in a larger sense as dental public health professionals? Are there other ways we should be capturing these pieces? Amy is sharing that they have many other concerns and they aren't worried about teeth until they are in pain. Yes, and Amy, something that also comes up on these calls is oral health literacy. And so I wonder if you feel like that ties into that kind of other concerns outweighing preventative oral health care. You guys are doing great. I'm loving all of these. Okay, we talked about the patient care coordination. And Carol's also saying some low-income vets have Medicare Advantage or other insurance benefits, but need more than what insurance can cover. Yes, absolutely. And I think that that's where some of those innovative programming pieces can kind of come into play. Okay, this was really great. Thank you guys for being so engaged and sharing all of that. Really fantastic. Okay, so let's head on over to our next slide, and we're going to talk a little bit more about how we can use your state profile. So again, acknowledging that Iowa is unique, that you do have this state profile, which we hope is very useful, and we design these to be graphically appealing so they're really easy to grab and use with decision makers. But we also have a very full in-depth report on Iowa. So if you're doing grant writing or program writing, there is even more data for you in Iowa to pull through that report or our executive summaries. But again, kind of looking at all of those details we looked at, I hope it's informative. Really what we want you to take away from this session is next steps and how you can leverage these tools in your work. So using the data to illustrate the need, sharing the profile to start conversations, and taking action to elevate success stories. So we are going to go through and look a little bit more specifically on how we can do that. We can go to the next slide. So one of the most powerful things we can do with data is to advocate. And that can look different depending on your role. So maybe you're a provider, a policymaker, or a veteran yourself. This profile gives you credible local data to bring to your city council, your state legislators, or your congressional reps. You could also organize a listening session in your community, invite decision makers, hear veterans speak themselves, and remember, small advocacy actions like calling an elected official or submitting a public comment or even coming to an educational session or putting on an educational session yourself, those can really ripple out in big ways. So advocacy is big and small, and it is all very important. Okay. We can go to the next slide, and we're going to talk about education. So many people working in healthcare or veteran services don't know how stark the oral health gap is. That was really kind of the starting point where we started, right? There's two pieces to it. Oral health in general, kind of understanding the gap and understanding those systemic connections. Those can seem really obvious to all of us who are in depth in this work all day, every day, but kind of starting there, and also that veterans don't have that access through the VA. So again, you can be using this profile to lead a short talk with your organization staff. Maybe it's a staff meeting and you share this out with your colleagues, another coalition meeting, or a partner organization. So when stakeholders are informed, they become allies, and that's how we build momentum. Annalise mentioned our strategic plan on veteran oral health that's coming out. The designed version of that. I know we worked with some really wonderful stakeholders in Iowa to get that together. There's a full stakeholder analysis in there about who is in the state and who is activated to move on this. So it's always an opportunity to collaborate across silos. So maybe you can bring this to someone in housing or mental health or food access and find a new way to align your efforts. And again, this strategic plan that we have coming out in Iowa dives into that a little bit more. That's specifically informed about the stakeholders in your state. Okay, we can go to the next slide and talk about informing strategic decisions. So this data is a tool for strategic thinking, whether you're leading a nonprofit, managing a health program, or advising on policy. You can use the state profiles to help decide where to focus. Again, looking at those maps and those geographic areas, that's a way to do it. Maybe there's a rural county with no dental providers, population group at high risk. This also makes the case for why you're investing resources where you are, right? I think having the data, but also in a really clearly designed and organized tool is hopefully really helpful to make that case very clear. And if you're doing an evaluation or reporting, it gives you a baseline. Here's where we started, and here's where we're trying to shift to. Looking at our next slide, we're going to talk a little bit about funding. So let's talk about how this profile can bring in resources for your work. Grant makers and funders want to see data. They want to see it grounded in the community, and this profile will hopefully give that to you for the work that you're doing. You can use it as the problem statement for your grant or show the gaps in care. And again, citing it as a foundation for what your solution will address and as a benchmark when you're measuring those outcomes. Going to the next slide, I'm going to pause here, and actually we can come off sharing screens for a minute, Christine, and I just want to see if folks have any questions that they want to dive into or that we can answer.
Well, I actually have a couple questions.
Yeah.
Hopefully I didn't miss the answers in your presentation, which was very informative. So to my understanding, you said that only about 10% of vets are eligible for dental care from the VHA. And I was wondering if you could just speak a little more to sort of what constitutes eligibility for vets to be able to access dental care through the VA. And then secondly, just curious if you've done any sort of data digging into what percentage of vets would be eligible for state benefits, such as Medicaid for dental care?
Yes, that's a great question. Thank you. And I'm going to also give the caveat that Annalise will interrupt me and correct my numbers if I'm wrong. So we have about 75% of veterans who are eligible for healthcare through the VA aren't eligible for dental care benefits. And it's fairly complicated on how that eligibility works and how that happens. But kind of the broad overview of it is it's based on a disability rating, which I'll also note I had a wonderful conversation with some folks at our Hill Day and was saying, you know what, I think my Army wife is really showing, and disability rating might be a term that we should start and define that, because disability rating as a military spouse makes automatic sense to me, but maybe not for everyone. So when people are getting out of military service and they're no longer active duty, there's a lot of administrative processes with that. And part of that is they get a disability rating. And I think another unknown thing is probably most people, this is anecdotal, but I would say most people walk away with 10% or 5% or some sort of percentage, right? And to have eligibility for dental care, you have to have 100% disability. Or there's a really small amount of people who are eligible because they have a service-related injury that's connected to the mouth, directly affecting their mouth and needing care there directly to the injury and the disability. So again, it's pretty complicated, but that's the broad overview of how eligibility happens. And I will also say, we talked about that being set by the federal code. We saw an uptick in veterans who were eligible for dental care in the past year. That was due to the PACT Act, and that didn't increase dental benefits, but it increased the amount of people who were getting that 100% disability rating. And so by proxy, the amount of people who are then therefore eligible for dental care. Does that make sense, or is there further clarity I can give there?
Liz, I'll jump in and add
Yeah.
to, we actually did try to look at Medicaid data for the state of Iowa to see what veterans may be eligible. Those data were not available to us. It's very difficult as a non-state entity to get access to those data. However, we do know at the state level that Iowa leaders are concerned and looking into what veteran healthcare looks like in the current systems that are managed by the state and the state data that is currently being collected on veterans. So unfortunately, we don't have state-specific data in terms of access to Medicaid or to Medicare. We did look into it, and I just wanted to note that we just unfortunately weren't able to access any additional data around that. But if anyone has access to it, we would love to partner with them in that effort.
Thanks, Annalise. What other questions can we, oh, sorry, Curly, did you have something else? What other questions can we answer?
Liz, I'll just add, is it true that a lot of veterans, not a lot, but a percentage of them don't actually pursue their disability ranking, whether it's a lack of knowledge of what benefits they're leaving behind? I thought I read that somewhere, and I'm just curious if it's a educational issue of go and get yourself evaluated so you know what your disability ranking is.
I'll let Annalise chime in too on her thoughts, but I think we talked about that. I don't know about broadly on disability rating and benefits in general, but we talked about that low utilization rate for dental benefits specifically, and we need more data there. But we do think a misunderstanding of benefits is one of the pieces that plays into that. Annalise, I think I saw Carol come off mute, and Annalise, I think you might have thoughts there too.
I was just going to reinforce exactly what you said, that when we partnered with the VFW for a national survey in 2021, we did ask veterans, do you understand your benefits? Do you understand your medical benefits? And for veterans who responded to that question, we had about 2,500 respond to to this survey, and almost 100%, it was like 98%, understood whether or not they had medical benefits through the VA. When we asked the same question and we said, do you understand if you have dental benefits through the VA? 42% said, I don't know. So I think there's some educational pieces here But also, Christine, to your point, we don't have any specific data around who pursues a VA disability rating and who doesn't. Anecdotally, what I can say is the point of separation becomes a really critical timepiece. And maybe, Carol, this is where you want to hop in and add more. But in order to get all people who are separating from active duty are entitled to get an evaluation through the VA for their oral health as well. It's usually within 6 months of separation. And I think it's an underutilized opportunity to get baseline information on where your oral health is and then potentially pursue disability ratings later through changes in your oral health or just get connected into care. Carol, is there something you wanted to hop in there with?
Well, I think we've probably talked about this before, but just in general, in our experiences, my husband and I, over the years, we feel like a lot of people separating from the military really have no idea that they could potentially utilize VA side of things for medical. Again, like you were saying, with getting that dental exam, prior to, having that 6-month leeway, but just understanding all of that for your average veteran getting out. I just don't think that they do. I don't think that there's enough explanation on how all of that would work for them once they've separated. And certainly joining some of these veterans groups can be really helpful for our veterans in learning about. That's exactly how my husband learned about some things after separating from the military. And then, of course, he worked for the VA hospital. So he gained a wealth of knowledge there too. But I just don't think, and I don't have data on that, obviously, it's just my personal opinion, but I just don't think a lot of people understand what's out there for them once they do separate, if anything. And maybe for some there isn't. And the disability ratings aren't necessarily something that I think is talked about much either. But to get that 100% in order to utilize, to be able to have benefits through the VA is pretty much, it's not easy to get that 100% for most veterans. So that's what little I know to be dangerous.
And I think to Carol's point, I think you also have to understand that veterans that are separating now, so active duty, so they're rather young. So when they get out and they're told you can receive a dental visit, which oftentimes doesn't happen at their point of separation, which might be a particular camp that they're at, et cetera, that's not high on their list. So then when they would come to somebody like me when I was serving as a VSO and they wanted to get that dental benefit, getting into a dentist in a rather short time period was impossible in an area where you don't have dentists available. So they might understand that they have it, but also the younger they were, the more indestructible they were. And I don't have problems now. I don't need to do that. So that's also part of the educating, is that they just need to understand it's important regardless of your age that you get a dental exam.
I would definitely agree with that, Jackie. I've had a couple just recently younger veterans in need of some dental care that probably, had they utilized that benefit to them, probably could have been taken care of. Yeah, but I would agree with that 100%.
Yeah, thank you both. And really hearing, kind of double tapping on that piece that we talked about with that oral health literacy and education piece really comes into play at many levels there. I also want to highlight, if folks didn't see in the chat, Brendan sharing here a small but growing body of research on oral health insurance literacy, which can be a significant barrier. So that's exciting to hear that it's a growing body of research, and I'm looking forward to kind of seeing what else happens in that space and keeping tabs there. We have just a few minutes. I'm going to pull our slides back up and we'll probably skip ahead a few spots and leave y'all with some action items and highlight some pieces here. Okay, we can skip ahead and ahead. Okay. So I mentioned at the top of the call, we always highlight Iowa to other states that we're talking about. So give yourselves a little pat on the back for being a pillar of a good example. We like to just take a minute and look at some interesting things that are happening at the state level. Because again, while eligibility is determined by the federal code, which is what we talked about at the top of this call, there are innovative things that the states can do to do state-based programming to increase access and advance oral health for veterans. So highlighting here, looking at Florida. Florida passed legislation creating the Veterans Dental Care Grant Program, which might sound familiar, within the Florida Department of Veterans Affairs. So this program is designed to provide dental care to veterans living in Florida. The department will partner with a statewide direct support organization to administer the program. So that organization will distribute grants to nonprofits with a strong track record of serving veterans. And those nonprofits will deliver care to eligible veterans based on income, service history, and other qualifying criteria. This is really new legislation. It's just being implemented now. I think maybe April is when implementation started. So it's something that we're tracking, and we're really interested to see how this pans out for Florida. We always love to see an innovative approach. So something for you all to keep your eye on, and we'll keep our eye on and keep everyone updated. Oregon is another state that has a good innovative program. They developed a Medicaid carve-out specifically for veterans who don't qualify for VA dental benefits or traditional Medicaid. So veterans are first screened to determine if they qualify for either, and if not, they're enrolled in a local coordinated care organization and receive free dental care through a network of community clinics participating in the program. And Iowa, again, your state, so you're familiar. We always highlight that you use lottery dollars to fund the Veterans Trust Fund, which provides direct grants to veterans to help cover out-of-pocket health expenses, including dental care. And other states are always interested and excited to hear about that. We can click through the next slides. We talked a lot about the in-depth work we have done in Iowa and the report. Again, available on vetdentaldata.org. We can click through again. There's a full report. We have done community forums. Oh, it's just a, if you just click, it's a little, there you go. You'll see there are summaries and recordings of the community forums we did and the in-person summit we did on veteran oral health. So if you weren't involved in those, you can take a little bit of a deeper dive on your state. And again, our strategic plan will be posted here shortly there as well. Okay, so if we go to the next slide, and the next, we're just gonna skip ahead until we see call to action. One more, I think. Okay, so we reviewed a lot of information. We had a really wonderful conversation here today. I hope you are feeling activated, but I also know it's a lot of information to take in. We're all very busy, so it's easy to kind of hop to our next meeting and move on and let it go out of our mind. So I want to leave you with one concrete, easy step to take after the session to keep the momentum going and capitalize on that activation I hope that you're feeling. And that's to share the state profile with one new person or organization. And if you're willing to post in the chat who you're going to share it with, we'd love to hear that. Keep each other engaged and encouraged about this work. I will also note, we said at the top of the call, these slides will be posted, the recording will be posted, so you will have access to all of this information. There's very in-depth information available on these slides and in the reports, so when you have some time to kind of think about the data more deeply, those will be there for you as well. Looking at our next steps, we also started at the top of the call. CEUs are available for today's sessions. Those are available on our Academy. And Annalise, if you have the link, if you're able to pop that in the chat, that would be great. And if not, I can grab it in a second. So you click through with the link. That's where the recording and the slides will be posted, and it's also where you access the CEU. We are also gathering stories from veterans. We would love to hear from veterans in your state with our storytelling forum. That's part of our ongoing advocacy. So we're going to pop that link in the chat as well. If you yourself are a veteran or you know a veteran who you think would want to share their story, we would love to hear from you or them. And again, you can find all of our publications and data on vetdentaldata.org. And with that, I leave you with the fact that we believe that if we go to the next slide, veterans deserve equitable oral health. Thank you for being with us here today. Thank you for being engaged and participating in conversation, sharing out about your work. Let us know if questions arise. We're always here to support and to discuss. And we look forward to seeing you all again in the future. Thank you, everyone.